uh, International Forum for Promotion of Homeopathy, IFPH, is conducting continued webinars for the last 310 days. And today we have with us Dr. S. Gopinathn, BSc BHMS MD FETP, Thailand, on research study design with a special preference to homeopathy. We had the first part of the discussion last week, and today we have the second part of the discussion. 35 years of professional experience and 32 years in research with the Central Council for Research in Homeopathy. He got a WHO fellowship in 2003 in Thailand, and his specialty is psychiatry. He has published many scientific papers and participated in more than 100 national and international seminars. Retired in 2018 as professor and HOD of the Department of Psychiatry and the Homeopathic Research Institute in Mental Health, Kottayam. Now I invite Dr. S. Gopinathn, my friend, colleague, and classmate, to this forum. And also, we will have a 30-minute speech, and after that, a 30 minutes discussion and questions. Now, I invite Dr. Gopinathn again.
Thank you, Dr. Jose. Is it audible?
Yes, no problem.
Okay. A very good afternoon, good morning, good afternoon, and good evening. So anyway, today is the second part of the research methodology and study design. I already told you that this is a vast subject. In the first session, I have discussed some of the important points, which is most related to the clinical research. Within the first 5 to 10 minutes, we will summarize what we have discussed in the last one. One thing we have discussed is what is the difference between observational study and experimental studies. The second is what is difference between matched group or independent group. Another is different types of observational studies like case series studies, cohort studies, case control studies, like that, cohort studies, cross-sectional studies. There are different types of observational studies. Then another point, I am telling the most important points only, confounding and matching. Then sampling. This is very, very important. A sample, to select a correct sample is very, very important because it should represent the whole population from which the sample is selected. And different types of sampling, I mentioned the name, that is random sampling, systemic sampling, stratified sampling, then cluster and sequential sampling, convenience. There are different types of sampling is there, but the most important one is the random sampling. What is the random sampling means? Because it should represent the population completely 100%. For example, if we summarize, suppose there are in a population there are 400 men and 200 women. That means half of the population. If we take that is in a population 400 is men and 200 is the women. That is the ratio. So when you select the sample, the sample also should contain this ratio. That is that way, that half of one the sample contains. That I means the men, in the sample, the number of female should be half of the men subjects. That is the men. You might have heard it. What is a random number, random sampling? For example, suppose you are going to conduct a study in a population where where you have 100 men and 50 females, the sample also should have the same ratio, 2:1. That is the simple thing. Then another point we have discussed is research question. Every research starts with a research question. For example, simply one thing we can say that whether the question whether the homeopathic medicine is effective, that is one thing, or whether the homeopathic medicine is effective in a particular disease condition, whether the homeopathic medicine is effective in controlling this COVID-19, whether the homeopathic medicine is effective in depression, or whether the homeopathic medicine is effective in schizophrenia or anxiety disorder, like that. These are the research question. From the research question, we will start our work. One thing. Then another is outcome variables. How to measure the results of the research study. There are different outcome variables that also we have discussed. One is outcome variables measuring the biological aspect. Biological aspect means it consists of the symptoms, signs and symptoms. That is the improvement in symptoms and sign, improvement in the biological other variables like lab variables. For example, in a case of chronic bronchitis, more than the blood results, the pulmonary function test is very, very important, which is more important than the X-ray. Like that, these are the biochemical variables. It can be a lab result, it can be an X-ray result, this can be a CT scan result, whatever it may be. So these are biological variables. Then outcome variables measuring the efficacy. Efficacy means usually the effectiveness and efficacy is assessed by statistical methods. Then the benefits to the patient, other than the relief of the symptoms or other thing. One is, I told you, the quality of life and also the prolongation of the lifetime. And another thing is outcome variables measuring the satisfaction of the patient. So these are different types of outcome variables. For example, when we discuss about the outcome variables of biological, we have, I will say a few examples. For example, in biological variables, when we measure, we must have a disease intensity score, that is before the trial of the patient, and also a disease intensity score, that is after the trial, that is pre-trial disease intensity score and the post-trial disease intensity score are very, very important. This you cannot do by your own. There are different rating scales are there in different disease conditions. Those rating scales are internationally accepted one that we can use for our biological assessment. For example, since I am mostly involved in psychiatric research, I can see a few examples. If you want, you can note it. One is, for example, in a case of depression, you can use one scale, this Beck depression inventory. Beck depression inventory, which contains a lot of questionnaires. With the questions and giving the scores, you can make a pre-clinical, pre-trial scores in depression. Another one is in psychiatry, in psychosis, we use another rating scale from the brief psychiatric rating scales, which is usually used in psychotic conditions like schizophrenia and other things. Another rating scale we use in schizophrenia is PANS, positive and negative symptoms of schizophrenia. Also, clinical global impression scale is there that can be used in any studies. Clinical global impression. This assessment will be done by the who is assessing that particular patient. Then is HDR, Hamilton depression rating scale. Another rating scale is there. Then we can CARS, Corner's autism rating scale. In autism, we are using this scale to find out the disease intensity score before and after. Then Corner's parent rating scale, which we use in ADHD, attention deficit hyperactivity disorder. Then maniac infantry. Like that, there are so many rating scales in psychiatry. Anxiety rating scales are there. Similarly, in other, for example, in a joint disease, if you want to make some studies, some other rating scales are there. Visual analog scale is there. Visual analog. For example, suppose in a case of acute arthritis, you can see the part of the uh, that is the joint, and you can make an assessment, that is a visual analog. Similarly, verbal rating scale is there. Patient himself can say that how the pain is improved or not. What is the intensity of the in that way you can give some scoring, that is before the treatment, and or before the trial, or after and after the trial. And similarly, rheumatoid arthritis severity rating scale, numerical ratings. There are different scales are there. Then also for the WHO QOL, World Health Organization quality of life rating scales, there are, so that depends on different. That is for different disease conditions. This quality of life improvement scales are there. So these are some of the tools which we use to make a biological assessment. So with this rating scale, make an assessment before the trial, and with the same rating scale, assess after the trial, and they find out the difference between the two scores. And this difference in the scores can be used for statistical analysis. Then for the statistical, different types of statistical analysis is there, but now it is very easy. There are different softwares are there. Your data can be put into this softwares, and you will get a clinical statistical assessment. There are different correlation scale is there. This chi-square improvement scale is there. Chi-square, the independence variables, the regression variables, then factor analysis. There are different types of statistical analysis is also there, which also will be used for different studies. And also I told you about the assessing the what is the satisfaction of the patient. For this, there is no tools is available. Then and I told you about observational study. What is that observational study means? Here we will not interfere in any of the period or any of the time in that particular case. Simply we observe or take some measurement, that's all. We will not intervene in any way, by advice or by drag or by suggestion or whatever may be. We will not interfere in any way. Whereas in a clinical trial or an experimental trial, we actively involve or intervene. There will be active intervention time to time. For example, in the selection of the patient, the administration of the medicines, taking the measurements, analyzing. There are so many things. So many interventions are there in experimental studies, whereas in observational studies, nothing is there. You just observe the patient, observe the things, and take some values, some measurement, that's all. Then I told you about observational studies. Case series studies, I mentioned, you may be remembering about the case series studies will lead to the arrival of HIV, is it not? You may be remembering, is it not? This study is this is a case series study conducted in CDC, Central for Disease Control in USA. Some of the scientists noticed that an increased need of a drug for pneumocystic RNA, which led to the discovery of that. Similarly, cross-section study, I told you, you intervene in a particular time only once. That is a snapshot study. For example, you have 100 person in your OPD, take the BP and take the body mass index and find out the relation. That is a one-time reading. What is then find out what is the relation between. This type of study was conducted in China in 1993 and established the relationship between the body mass index and the development of hypertension. That is another thing. Then a cohort study. Cohort study means cohort means a group. So here, the study to eternity, from here to eternity. For example, so measurement of subject will be taking place twice. That means definitely before and after, or today, or and tomorrow, or day after tomorrow, or when the study begins and at the end of the study. So this type of study by some scientists in UK, that is Dole and Hill, they found the relationship between the cigarette smoking and death due to different disease. But this study was conducted in 600 doctors in UK. 600 doctors in UK, they all are smoking, and they have followed for a few years and found that the 60% of them died of different disease conditions. That is done in UK. Similarly, a case control study, this is the same thing as but backward. For example, you have a group of individuals with you with lung cancer, and you go back to the history, take the history records, everything of the patient previous history, and found that the 70%, 80% have the history of smoking. So you can make a relationship between smoking and development of lung cancer. So this is a case control study. Then this case control study, there are two types of matched and unmatched one. For example, suppose you take patients are having the same age, they are the same sex. That means this is a matched study. All persons are having the same age and is from the same sex. So this study is a matched study. Whereas if you take in a group, there are different age group patient and a different that is two say male and female, everybody is there, then you can say that it's an unmatched study. You can make an observation, that's all. So clinical trials, that is the most important last one, that is clinical trials or experimental study. There are different experimental studies are there. You can make a preventive trial. You can make a pilot study or screening trials, treatment trials, quality of trial, different types are there. Then see, in clinical trial, always we intervene with some instruments, for example, medicine or whatever it may be. And to have to maintain two groups or compare two groups with some clinical intervention. Clinical intervention, in textbook it says from kind advice to medication. From kind advice to medication. Anything can be from a kind advice. So that is the intervention. So when we talk about clinical trials, some important points to be remembered. One is treatment group and control group. In clinical trials, control group is very, very important. This is the mostly accepted method. Treatment group means who receives medicine. So these clinical trials, I told you, it can be the assessing the effect of a particular drug or assessing the effect of a particular drug compared with an existing drug also. Or you can say that comparing the effect of homeopathic medicine in a particular disease condition with the patients taking allopathic medicine. Then I told you about confounding that factors. There are factors which is affecting our study and making the study biased. For example, suppose you are doing one study or conducting one study. You want to remove all the smoking is a confounding factor. You have to remove it. Also, what you have to do, either you have to select all the patients smoking, or you should not select the patient. You should select the patient, all subjects who are not smoking. In this way, you can avoid. Similarly, age group. There are, if you do the study in different age group, again it may affect this study. So it is better to select a particular group, age group of the patient, the individuals with the including, for example, you can say that 10 to 20 years of age or 20 to 30 years of age, 30 to 40, like that you can overcome this confounding factor. Similarly, different confounding factors are there. For example, when a particular scientist is doing with the homeopathic medicine, we know that some diet restriction is very, very important. We usually ask the patient to avoid coffee, tea, and other things. Some are taking coffee and tea. If you do not know what is happening with the patient, what will happen? It will definitely affect the study. So what you have to do? Ask all the individuals, all the subjects who are included under this trial should avoid coffee, tea, like that. Anything can be a confounding factors. Then randomization. Randomization is very, very important, because randomized control trial is the most important one. The randomized control trial gives the most robust and dependable results in a particular set. Randomization means it is very easy nowadays. You will be getting if you give the details of your study, the hypothesis, everything, and in which population you want to take the study, what is the disease condition, what is its prevalence, what is incidence, like that. If you give all these details to a statistician, he will make a random computer generated random number table. And with the help of that table, you can enroll the patient into two groups. And one group will be a control group, and another group will be a experimental group. You can make a study. Then blinding, that is another important we have discussed. The blinding means you suppose the doctor knows he is taking a medicine, sorry, he is giving a medicine, but the subject knows he is taking, whether he is taking medicine or a placebo. That is very, very important. So doctor knows which patient received placebo and which one receives medicine. But the patient does not know whether I am getting placebo or medicine, because they are identical in appearance and everything, color, appearance, whatever it may be, taste or whatever it may be. So patient does not know. This is a single blind method. Double blind method, I told you that both the doctor as well as the patient or the subject do not know whether they are getting or the doctor giving medicine or placebo. It's a third person who is having all the details about the drug and everything. He only knows. So that is a double blind. If you are not blinding anything, suppose you give medicines to all patients for assessing. Suppose you are giving arsenic album, or suppose you are giving some other drug or hypertension to all patients. No placebo is involved or no control group is kept. It is called an open clinical trial. Open clinical trial. I already also told you about the parallel design. Parallel design means throughout the study, one group receive medicine and other group receive placebo or the other existing conventional drug. That is a parallel design. Crossover design, I told you, there are two groups. One is the control group and other is the experimental group. Experimental group is receiving the drug under study. The control group is getting placebo or the conventional drug. And after a period of study, you will reverse everything. That is, after a washout period, the experimental group will get the placebo or the conventional drug, and the other group, that is the second group, control group, will get the medicine under study. Have you heard about intention to treat? Any idea about that intention to treat? So there is a problem in RCT because there are two groups in a randomized control trial. One is the treatment group and other is control group. There may be chance of dropouts. There is maybe, suppose in a 50 persons are there in the experimental group and 50 in the control group. So after some time from the control group, there are so many persons are this getting dropped out. So what will happen? This will adversely affect the study. So what will happen? Suppose the patient is has gone in the midst of the study. That particular value, the last value, will take its final value, as if he is continuing the study. Like that, we'll take. For example, in experimental group there are experimental group there are 10 patients, and the other group there are 10 patients, and there are dropout of 5 patients in the control group, and that there are some data you have collected in between from those particular patients who have gone for the study. Those values will be taken as the final value, and that will be used for the final analysis. This is called intention to treat. This is a method of statistical analysis. Then have you heard about another important method which we have not discussed about the phase 1, phase 2, phase 3, and phase 4 in clinical trials? What is a phase 1 trial? You might have heard, or you may be knowing all these things. Phase 1 trial, you know, this is actually this particular drug substance is administered a small group of say some 20 to 80 number of patients to assess the safety of the drug before proceeding to the full study or the complete study or a clinical trial. So this is the phase 1 trial. A particular drug, you may be knowing that all these vaccines have tested in different walls. The most important point is that these drugs will be administered in volunteers only. Those who are coming voluntarily and participating, they will be given a particular drug in a particular dose in 20 number and to find out the safety of the drug before. That is the phase 1. Phase 2 study means this particular drug is given. This phase 1 trials drug will be given in hundreds of patients, you know, with the same dose to find out what will be the effect. That is the phase 2 study. And a phase 3 study, you know, the participants will be at least 3,000. You know, this is actually the clinical trial to find out the clinical efficacy of the drug. Okay, so that is the phase 3. And phase 4, actually this phase 4 study will be usually conducted after the drug is approved and marketed. And this is to find out what will be the side effects for over a time of period to find out any side effect is there. That is the phase 4 trial. So for our research, that is homeopathic, we don't have this type of phase 4 trial and all this thing. But phase 1 trial is important. It is a pilot study. You will get a lot of information before proceeding to the full study. And a clinical phase 2 and phase 3 also can be done in a homeopathic research. I already told you that in clinical research study homeopathy, there are some important things to remember. One is that, you know, one is our individualistic approach. And the second point is we are using a dynamized drug one. Then another thing is that this is conducted in human beings. There are a lot of variables in human beings like age, sex, genetic differences there. There are so many things. Disease duration will be different. The causation may be different. There are so many things. And another thing is that the modus operandi of the drug is not known. So there are so many fundamental research are going on, but still we do not know what is the modus operandi, how it is acting, the pathway it is acting. That is one thing. Then another important thing is that it cannot, when there is a challenge, it cannot be repeated. That is another important point. When there is a challenge, because if you want to repeat, you should get this similar group of individuals with the similar suffering, similar individuality, all this. So it is very difficult. That is very, very important. Then some of the other methodological problems that we have discussed about individualistic approach, then the homeopathic aggravation, patient-doctor relationship, researchers qualification, we have discussed. Then some other important point to conduct clinical research in homeopathy. So there are different types of studies and analysis are going on in homeopathy. I told you about open clinical trials. What is open clinical trial? There is no control group. Then single blind and double blind studies can be conducted in homeopathy. Crossover and parallel studies can be conducted in homeopathy. It can be a single centric or multi-centric also. One study can be conducted in single center, or the same study with the same protocol, it can be conducted in different centers also. Then I already told about pilot studies, and then sequential studies are also there, clinical trials. Then some of the problems of RCT, that is in homeopathy. When you in homeopathy to conduct RCT, some important points you have to remember. So we'll be concluding within 1 or 2 seconds. Some important. This is very important. So when you
no problem. Continue.
Okay. One is a wrong choice of the remedy. There's a possibility of wrong choice of the remedy. There's a possibility of wrong selection of the potency may be wrong, and also repetition also will be And also failure at treatment, dose increasing or decreasing, going to the another potency. All these things are, there are a lot of problems are going on. There are a lot of discussions, lot of confusions are there. Then course of action cannot be predicted. So that is another thing. You are given a particular drug with a particular potency dose. So we are expecting a particular desired effect. We always expecting, but sometimes we will not get because of so many factors. Then doctor's prejudice is there, will be giving false positive and false negative results. It will result into false positive, false positive case. Then patient-doctor relationship. One thing when if the doctor-patient's relationship is not, there are so many points will be lacking when you take a history from the patient for particularly in the field of sexual part or sexual functions, everything. Patient may not be able to reveal some if the patient-doctor relationship is not good. Like that, there are so many problems. So what you have to do is, when you have a research question, you have to make a research protocol. That is very, very important. A research protocol is very important one. There you should have a good title. Title means a detailed title. The title should itself reveal what you are going to do. That is important. Then it should be an abstract. It contains introduction study, but it should not be elaborative. And the review of literature is very, very important. And materials and method, where you have to include one important thing is an inclusion and exclusion criteria. This is very important. Which type of patient you are including, this type of patient you are not. That criteria should be mentioned. And hypothesis, you have to generate a hypothesis of the study. That can be positive, it can be negative also. Then there should be the results of the study and its analysis. Then the discussion and conclusion, and also it is having references. So all these points are to be included. This. So these are some important points we have discussed in these 2 days. And if you can ask some question, you can. We will discuss some doubts if you have.
Those who want to ask questions may go to the chat box and raise their hand, please. I invite Dr. Hubert De Silva for his question.
Yeah. Good evening.
Good evening.
Yeah.
How are you?
Fine, fine, fine.
I want to ask you, the rating scales, is it available in the net?
So, some of them are available. You can freely download it, but yeah, most of them are, you have to pay, paid one.
Okay.
Oh, in CCRH, we used it to purchase it for lakhs of rupees, 2 lakhs, 3 lakhs, some 5 lakhs. And some you will get, and you will be getting some books having rating scale that you can copy. There are so many books are there in psychiatry, rating scales, textbooks are there, where it is given.
Then another one, the statistics for some software. You told that some
yes,
software statistics.
Yes, yes.
Which software? It's
The SPSS. That is very, very important. Now, I think the version 21 or 22 is there. Version 21 or 22. Last. Because I am not using now, that is latest one. This 21 or 22 question, that I know. Yes.
Then another question I want to ask you. If there is, we know that possessions, some cases of possessions, say that there are some spiritual problems, we call it as Pishajabada, that type of things. Yes. What is the method of taking the analysis of the cases? How you can distinguish it between this one is a spiritual case and this one is a psychological case and this one. So how?
See, the insight. it is very easy to differentiate in psychological case whether it is mimicking one or it is what you told about this batha, preta batha, and all these things, you know. So in psychiatry, in all there are a lot of symptoms. There are a lot of intervening of symptoms are there, because you can find some of the symptoms are in all psychiatric. So how the diagnosis is made in psychiatry depending upon some major criteria or first rank symptom or second rank symptom, like that, you know. So but this type of symptoms you will not get the other condition, mimicking case or other. For example, I can simply say that suppose you know, suppose a patient is brought to you in a with some kind of this seizure problems.
Yeah.
It's brought, or patient is simply brought with a somebody, so that he is having some fits. I have seen this patient is having some fits, and another patient is brought to you with some other patient with the same condition, like that. You can make a difference. For example, suppose it is a case of a neuropsychiatric case. For example, epilepsy is a neuropsychiatric case, but hysterical neurosis, you know, this is hysterical neurosis is a purely a psychiatric. So both will be manifested. Will be manifesting this fates or features. So some few questions, and from the history you can make a differentiation. For example, if in a case of a true seizure case, immediately after the seizure you do a Babinski, you will get a Babinski, this positive. Whereas in hysterical you will not get. Then the another time of the when you examine the eyeballs in a case of a seizure, a true seizure, the eyeballs is dilated and fixed, and the pulse will be bounding. Pulse will be bounding in a case of seizure. Whereas in other case, that is in hysterical neurosis, the patient will not even open the eye. You cannot very easy patient. You can see the eyeballs will be rolling here and there. That is another thing. From the history also, you can say that you will get if the relatives come in a case of hysterical, the relatives say that it never occur during sleep. It never occurs during sleep. It always occurs when some patients are or some other persons are nearby. Then only this particular person is getting this complaint. This is a hysterical neurosis. But mostly in a seizure, true seizure, in epilepsy, the most of the episodes will be coming during sleep. It can be otherwise also. But hysterical neurosis will never occur during sleep. That is similarly, there are so many points are there by which you can differentiate whether it is a true psychiatric case or neuropsychiatric case. Or similar.
How can it manage? How can it manage? How can it manage?
Manage with medications and so many other counseling advice, hysterical neurosis. That is another thing. With medications and other things.
Okay, thank you, sir. Thank you.
Yeah.
Sir.
Okay, now
Thank
I
you.
invite Dr. Anand Jaiswal for his question.
Hello.
Dr.
Hello.
Anand
Good evening,
Jaiswal.
sir. Hello, can you hear me?
Yeah.
Yes.
Good morning, good afternoon, good evening, everybody. I have a question. If I want to go to any study, is there any organizational support needed? Can I myself can do a study? If I do a study, where it is published?
I don't understand your question because it is not properly heard.
No, if he wants to go for a research study, what he should do?
He can
Or is there
approach.
any research body which helps?
Yes, definitely. You can. Anybody can approach a CCRH. Anybody can approach a CCRH. They will be giving advice. They will be helping to make the protocols. They will be supporting with the finance also.
Okay. And for ethical committees, sir, for ethical clearance, is CCRH?
No, ethical clearance means suppose you are doing a research in a particular institute or an institution where you have an ethical committee, it is okay. It is okay. Otherwise, you should get ethical clearance from CCRH.
Okay.
Yes.
Okay, now I invite. Okay, continue. You are finished? Have you finished your question? Okay, now I invite Dr. Parit Baba Khan for his questions.
Thank you, sir. Good evening, doctor.
Good evening, sir.
I have a general question. First of all, regarding the research, first of all, we have to find out the define the problem. That's the main thing. Define the problem. Then we have to identify the factors affecting that problem. From that, we have to list out the solutions. Solutions means various aspects, that is effectiveness of, especially for treatment sciences, effectiveness, safety, social aspects, economic aspects, and such other things.
Yes.
Then we have to conduct the study. The study, let's say treatment and also control group and also treatment group and all that, and various levels of treatments. Then we have to measure the variables. Is it not?
Yes.
Yes, this is what then from the result we will have to analyze using statistical techniques and all that.
Yes.
Then now it is very easy by using computer and all that software, and you mentioned everything. You made a very excellent presentation, no doubt about that. My question is, this homeopathy is a non-linear science.
Yes.
Is it?
Yes. Yes.
This technology or this methodology is applicable to there's a linear science also.
All this method, what I have mentioned.
Yes,
Definitely.
Is that
We have been using all these methodologies in homeopathic research also, but there are some difficulties. That is what I mentioned in the last. Some important point that is very, it will be affecting the significance of our study. That is what I said about the individualization, drug dynamization, then the repetition, then this what we call our miasmatic aspect. There are so many things we are including. All these things will adversely affect.
That is applicable to all biological studies or biological science. If you try to study in biology.
Clinical studies, all these are applied. But this dynamization, all these things are particular to homeopathy only. Is it not?
That's all right.
Then modus operandi, how the medicine is acting. You know, there are so many drugs in the conventional system also. The route of action is not known. The route of action is not known. There are, particularly in psychiatry, there are so many drugs are being used in which the mode of action or what is the site of action is not properly known. Even then, they are doing so many research with these drugs. So this can be adopted in homeopathy also then.
Do you mean that the methodology is same for linear science and non-linear science?
No, this methodology can see what are the study designs which I have mentioned that can be used for both.
Both for linear and non-linear sciences.
Yes.
Okay. No difference. Methodology, there is no difference.
Methodology is a basic methodology. There is no difference.
Okay.
Yes.
Now I invite Dr. Lokmani Gupta for his comments, questions.
Thank you, sir. So my question is that our drugs had been proved years back and in some particular geographical area, and we treat them accepted on international global area. Sir, should we revise, should we reconfirm, or they are still acting same in the different economical, socio-economical, and environmental conditions? My second question is, sir.
So, okay. Could you please repeat?
Sir, our drugs had been proved long years ago in some particular area.
Proved in?
Long back.
What?
No, what he says is our drugs are proved at some 200 years back in different situations. So how it will work now, whether there is anything, I think that's the question.
Yes, sir. Should we reconfirm the drugs? Or
that is what we are, there are some studies are going on in CCR. That is another thing. Another thing is that we have been doing research with our hobby. All these are reconfirmation only. We are not coming with a new drug and testing it in a particular patient. So all the studies are going on, that is in CCRH now.
Reproving.
All are reproving or reconfirmation only.
Yeah.
Because we are not using, we have not made any new drugs or something. Somebody is coming with the new drugs, all these are isopathy, not homeopathy.
Sir, my subsequent question is that
Yeah.
if the results are same as we are having in our books, or they are changing?
Pardon? What? Results are
Sir,
same?
No, what he says is whether the results are changing or it is the same as given in our Materia Medica.
Results are same. The studies, in most of the studies, the results are same. It is found effective. It is found effective.
these are found effective, but
No.
if some new symptoms are found there, or some symptoms are
That is in drug proving. That is in drug proving. They are conducting, the CCR is conducting. They are getting some symptomatology,
thank you,
new
sir.
symptoms, and everything is recorded. Everything is recorded, and you will get the publications from the CCR bulletin as well as the
Yeah,
IDRH.
I'm receiving a bulletin, a quarterly bulletin they are releasing.
And also this IDRH is there. They are publishing so many symptoms after reproving.
Yeah,
Yes.
I'm getting that book regularly.
Yes.
Thank you, sir. Thank you.
Thank you.
Okay,
Thank you very much.
now I invite Dr. Shaji Kudiyat for his questions.
Thank you, Dr. Josaisak, and thank you.
Yeah.
My question is, it is a comment come question, and
Yes.
it is just a follow-up question from Mr. Parit Baba Kansar, who asked a question about the difference in methodology to be adopted in researches based on linear science and non-linear science.
Yes.
In non-linear science are mainly considered for living organisms where there is dynamic components and physical components are there.
Okay.
Whereas linear science is based purely on material science. So the problem when we apply the methodology of a linear science research to a non-linear science research is that the entire components that constitute the living phenomena is not at all fully taken into consideration, because each of these components can produce variables in the physical plane. For example, the biochemistry of a human being can be entirely changed in different directions by changing the thought process. But that important aspect is never taken into consideration today by the linear research methodologies. And including in homeopathic research, when we simply follow the RCT double-blind study in homeopathy, the individualized treatment methodology, possibilities and potentials and better possibilities have difficulty in bringing its significance fully out, as you already mentioned. So these invite for development of new research methodologies that incorporate the entire components that constitute the living phenomena. And we are supposed to develop such a research methodology. And my question or your answer I am seeking, what we can do in such a direction, and do you think such a need is there? I honestly, I feel such a need is there, and it is our duty also to develop such a methodology and contribute to the furtherance of science. I am trying to contribute from my side for such a development. What do you think about it?
So, Dr. Sajid, what you said is absolutely right. I agree with you. Is one thing, but you know, such type of studies is going on, but still in the primitive stage. Without these human beings, the homeopathic drug substance are tested in the lab and other things, other methods are there. I already told you that there are collaborative studies are going on with our drugs administered in not in human beings, but in other things like you know, there are different studies are going on. I cannot mention all what are the titles and the type. There are different studies here. If you go through the IDRH, you will get such type of studies, but still in the primitive, all the fundamental research are still in the primitive stage.
Yeah, I agree with
Yes.
you, doctor.
Yeah.
I agree with you. But in my personal opinion, it is time for holistic
Yes, definitely.
doctors
Yes,
of
definitely,
holistic
definitely,
systems
definitely.
of medicine
Yes.
and researchers of holistic systems of medicine need to bring out this idea to the awareness of the scientific community and the political leadership, so that funding will be allowed for such a development, and researchers should be informed for in such a direction to develop such a methodology.
Yes, yes, yes.
So we
Right,
need
right.
to work for it, and we
Yes.
need to develop that thought process and also convey that thought process to the community, because a deficiency of such a methodology is the one forcing the allopathic system to argue and declare that only they are the scientific and others are unscientific,
Yes.
because there is nobody to declare as a final authority to decide what is science and what is non-scientific. What can be science today can be tomorrow pseudoscience. What is pseudoscience can be today pseudoscience can be tomorrow science also.
Science also.
When such a possibility exists, we have anything that happens naturally has a science behind it. But it is our duty to find out that science and bring to the awareness of the world. So in such a scenario, we have a huge responsibilities left with us to develop such research methodologies and bring to the awareness of the scientific community and the public at large, the world at large. And such a development will make homeopathy and holistic systems of medicine a better medical science than the current linear science based modern or allopathic system of medicine, is my opinion. And researchers like you, sir, need to contribute and need to bring that idea to the awareness of the officials, as you are recognized and officially representing homeopathic system as a official qualified researcher, and I am requesting you to contribute to such developments also. Thank you.
Thank you, Shaji Kodiyats. I will definitely join with you people, no doubt.
Whether you have any concluding statement to
I'm
say?
happy to say that.
Now I invite Dr. Astha Jain for his
Yes,
questions.
sir. A very good evening to all. So can you tell, please, some rating schools book?
Rating?
Rating scales book, sir, which you have told in psychiatry?
No,
You have
psychiatry
mentioned some, please.
rating scheme that I can give. I don't remember the book. I am having that book. I don't remember. It is the rating, different rating scales in
Different
psychiatric.
rating. So can
Yes.
you tell the name, please? Can you tell the name of that book, please?
I cannot tell the name. I can tell the rating scales. What are the rating scales? But I cannot tell the name of the book. If you want, I will send you this in WhatsApp or other.
Okay, thank you so
Because
much,
the
sir.
book
So
is
can
book is in not with me. It is in Kottayam. Now I am in Trivandrum. All those
Can
books
you
are in
give
Kottayam.
number, please, or WhatsApp number?
9847. The same number. Only one number. 9847.
Okay.
119906.
Thank you so much, sir.
Yeah.
Thanks a lot.
Yes.
Okay.
So I think the questions are finished, and I invite Dr. Shaji Kodiyat to say a vote of thanks.
I greatly appreciate the appearance and the deliverance of this important topic in our forum, because this is a very important topic where homeopathic doctors are lagging far behind, because we are never aware about the research methodologies and the research possibility. There are huge possibilities for research in homeopathy, but our homeopathy doctors are lagging far behind, and doctors like Dr. S. Gopinathn should come forward and have a huge responsibility remaining with Dr. Gopinathn to make the homeopathy community aware about the current possibilities and current methodologies, and also help them realize the need to promote and develop new methodologies that is based on nonlinear science, and need to demarcate the huge difference that is between linear scientific methodologies and nonlinear methodology. This is a subject that is not being discussed among the scientific community itself. So that's the reason why ICMR based and even our CCRH is insisting to follow the ICMR research methodology. And these differences are not well discussed among the scientists and the research community of CCRH also. I think it is time for us to develop and inform and convey this message, and Dr. Gopinathn has a huge responsibility on his shoulder. I highly appreciate for him to come forward and deliver this fundamental, currently available research to our community. And I also I am thanking you on behalf of International Forum for Promoting Homeopathy, and I also thank you, Dr. Jose Isaac, for inviting Dr. Gopinathn to our session to convey this message. And also I thank all those who participated today for this important discussion to have an awareness about this. So thank you all. Tomorrow we will have the same session in English at the same time at 8:30 p.m. And I request the next Malayalam Zoom session host to come for, and moderator Dr. Binduraj to come forward and take over the session. Thank you. Good night.
Thank you.
Dr.
Thank you.
Shajikudiya.
Thank you very much.
Thank you, Dr. Shajikudiya. നമ്മുടെ 313ാമത് സൂം IFPHന്റെ സൂം കോൺഫറൻസ് സൂം മീറ്റിംഗ് മലയാളം സെഷൻ ആരംഭിക്കുകയാണ്. ആദ്യമായി ഒരു മൗന പ്രാർത്ഥന. എല്ലാവർക്കും നമസ്കാരം. പതിവ് പോലെ ഇന്ന് നമ്മുടെ മലയാളം സെഷൻ ആരംഭിക്കുന്നു. ആദ്യത്തെ 45 മിനിറ്റ് നമ്മുടെ വിശിഷ്ടാതിഥി നമ്മളോട് സംസാരിക്കും. 45 മിനിറ്റിന് ശേഷമുള്ള 15 മിനിറ്റാണ് നമുക്ക് അദ്ദേഹവുമായി ചർച്ച നടത്താനുള്ള സമയം ഉള്ളത്. അപ്പോൾ നമുക്ക് നമ്മുടെ അതിഥിയായ ശ്രീ PV കൃഷ്ണൻകുട്ടി, ചെയർമാൻ എർത്തിയർ ഫൗണ്ടേഷൻ ട്രസ്റ്റിനെ ഹോമിയോപ്പതി നൽകിയ അനുഭവം, ആരോഗ്യ പരിപാലനത്തിന് ശുദ്ധ ഭക്ഷണക്രമം എന്ന വിഷയത്തെ ആസ്പദമാക്കി സംസാരിക്കാൻ ക്ഷണിക്കാം. സ്വാഗതം ചെയ്യാനായി ഡോക്ടർ അബ്ദുൽ ലത്തീഫ് സാറിനെ ക്ഷണിക്കുന്നു.
ബാക്കെൻഡിലെ പ്രമുഖരെ എല്ലാവർക്കും മലയാളം സൂം പ്രോഗ്രാമിലേക്ക് സ്വാഗതം. ഇന്ന് നമ്മുടെ പ്രശസ്ത അതിഥി ശ്രീ PV കൃഷ്ണൻകുട്ടി സാറാണ്. അദ്ദേഹം KCB നിന്ന് റിട്ടയർ ചെയ്തിട്ട് ദൈനംദിന പ്രോഗ്രാമിൽ മനുഷ്യർക്ക് കഴിക്കേണ്ട ആഹാരം എന്തായിരിക്കണം, എന്ത് ഗുണമേന്മയുള്ളതായിരിക്കണം എന്ന് വളരെ വ്യക്തമായി മനസ്സിലാക്കിയ ശേഷം കാർഷിക വിളകളിലേക്ക്, ഉൽപ്പാദനത്തിലേക്ക് കടന്നു വന്ന ഒരു വ്യക്തിത്വമാണ്. ഓർഗാനിക് കാർഷിക വിളകൾ എന്ത് ചെയ്യുന്നു, അത് എങ്ങനെയൊക്കെയാണ് കൃഷി ചെയ്യേണ്ടത്, അത് വെറും പച്ചക്കറികൾ മാത്രമല്ല, മറിച്ച് ഒരു മിൽക്ക്, അദ്ദേഹത്തിന് സ്വന്തമായ രീതിയിൽ ധാരാളമായിട്ടുള്ള പശുക്കളുണ്ട്. അത് ഈ കുള്ളൻ പശുക്കളെയാണ് അദ്ദേഹം ഏറ്റവും ഭംഗിയായ രീതിയിൽ വളർത്തി സംരക്ഷിച്ചത്. അദ്ദേഹത്തിന് അതിനെപ്പറ്റി അവാർഡ് കിട്ടിയിട്ടുണ്ട്. വളരെ മേഖലകളിൽ പ്രാവീണ്യം കാണിച്ച വ്യക്തി MCom പഠനം നടത്തിയ ശേഷവും മറ്റുള്ള ഒരു വിദ്യാഭ്യാസ മേഖലയിലേക്ക്, മറ്റുള്ള മേഖലയിലേക്ക് തിരിഞ്ഞു പോകാതെ ഇപ്പോൾ കോഴിക്കോട് ഏതാണ്ട് ഒരു 20 കിലോമീറ്ററിനും 25 കിലോമീറ്ററിനും അകലെ ഏക്കർ കണക്കിന് സ്ഥലമെടുത്ത് അവിടെ അതിൻ്റെ ഭൗതിക മേന്മകൾ ഉണ്ടാക്കി ഒരു ടൂറിസം കേന്ദ്രത്തിൻ്റെ പ്രവർത്തനത്തിലാണ് അദ്ദേഹം ഏർപ്പെട്ടിരിക്കുന്നത്. നല്ല കുത്തനെയുള്ള മലമ്പ്രദേശം, 4 ചുറ്റും ഇറക്കങ്ങൾ, അതുപോലെ നല്ല നല്ല ഈ ഒരു തരം വനത്തിൽ പോയെന്നൊരു അനുഭവം ഉണ്ടാക്കുന്നത്. അപ്പം ഇങ്ങനെ നല്ല കാര്യങ്ങളൊക്കെയാണ് അദ്ദേഹം ചെയ്തുകൊണ്ടിരിക്കുന്നത്. ചെയ്ത കാര്യങ്ങളെല്ലാം ജനങ്ങൾക്ക് ഗുണപ്രദമാകണം എന്നുള്ള ഒറ്റ ആത്മാർത്ഥത അദ്ദേഹത്തിനുള്ളൂ. ഞാൻ ഈ പല കാർഷിക വിളകളിലെ സെമിനാറിലൊക്കെ പോകുമ്പോഴും അദ്ദേഹത്തിൻ്റെ യൂണിറ്റ് അവിടെ ഉണ്ടാകും. നല്ല രീതിയിലാണ് പറഞ്ഞ് പഠിപ്പിക്കാനും അത് ഫോളോ ചെയ്യുന്നുണ്ടോ എന്ന് നടന്ന് പരിശോധിക്കാനും
അദ്ദേഹത്തിന് ഒരു പ്രത്യേക സാമർഥ്യമുണ്ട്. കിട്ടിയ അനുഭവങ്ങൾ സമൂഹത്തിന് തന്നെ നൽകാൻ തന്നെയാണ് അദ്ദേഹം തുറന്നിരിക്കുന്നത്. പിന്നെ അദ്ദേഹത്തിൻ്റെ പ്രസ്ഥാനം തന്നെ ഒരു നമ്മുടെ കേരളത്തിൻ്റെ പരിധിക്കപ്പുറത്ത്, കേരളത്തിൻ്റെ പുറത്ത് പോലും വേറെ സുഹൃത്ത് ബന്ധത്തോടു കൂടി നീട്ടിക്കൊണ്ടു പോവുകയാണ്. അദ്ദേഹത്തെ ഈ ചടങ്ങിലേക്ക് അദ്ദേഹത്തിന് കിട്ടിയ ഹോമിയോപ്പതി കൊണ്ട്